If you spent any time in healthcare, you've probably had one of those moments. Your patient is ready to leave. The treatment plan is solid. The clinical side is handled. But everyone in the room knows the real problem hasn't been solved. Because healthcare doesn't happen in a vacuum. People need stable housing, support systems, transportation, and community. They need an environment that gives them a realistic chance of succeeding once they leave your care. And if you've been doing this long enough, you've probably found yourself looking at the bigger picture and wondering, why are we always treating the symptoms of a broken system instead of helping to build a better one? That's one of the reasons I wanted to create this conversation. Most healthcare professionals spend years in school and training, earning trust, building relationships, and developing expertise that changes lives. And somewhere along the way, many start asking a different question. What else is possible? Not because they want to stop serving people, but because they want a greater role in shaping the environments where people live, recover, age, heal, and build. Imagine being part of a project where an underutilized building is transformed into something the community actually needs. What was once a neighborhood shopping center becomes an aging-in-place support hub designed to help seniors remain independent longer while staying connected to supportive services. A vacant commercial building is reimagined as housing and recovery support for veterans transitioning into their next chapter. A former hotel becomes healthcare workforce housing for the professionals communities are struggling to recruit and retain, or a mixed-use development that combines housing, wellness services, community support, and healthcare resources under one roof. Not just as a provider, but as a strategic partner helping shape what gets built. That's where I think things start to get interesting, because healthcare professionals see the gaps, the bottlenecks, and the consequences when people don't have the support systems they need. That perspective has tremendous value. The question is whether that perspective can be translated into ownership, partnership, and long-term impact. That's what we're exploring. Not simply opening private practices or acquiring buildings, but creating opportunities where healthcare expertise, redevelopment, housing, and community infrastructure can work together. For some people, that may mean owning a practice. For others, it may look like participating in healthcare-related redevelopment projects or helping create housing solutions connected to the populations they already serve every day. The opportunity isn't one specific model. It's positioning yourself to participate in projects, partnerships, and ownership opportunities that align with the expertise you've already spent years building. Because eventually, the question becomes, you've invested years building your expertise. What are you creating for yourself with it? If that question resonates with you, we'd love to have a conversation, because the people helping care for communities should have the opportunity to help shape them too.